Dr. Brad Jacobs.
Good to be here.
Good to see you, sir.
Yeah.
So we're jamming on some of your top 3 health initiatives or best practices. We talked about 3 things that you're passionate about right now.
Yeah.
So which one do you want to start with?
Let's talk about heart rate variability.
Ooh, my favorite metric.
Yes.
Yes.
Mine too.
And also the most vexing metric of them all sometimes, isn't it?
Agreed.
Yeah, so heart rate variability.
I've been really trying to mine into that. Number one.
Yeah, me too.
Trying to look at like Heart Math Institute or use your 8 sleep. What does that tell you? Use your wearable, your aura, or whatever. And they may all differ. And so trying to get people, A, to figure out which one they want to use for their HRV, and then 2, do different hacks and see how it affects your HRV, you know? Go out, drink alcohol, what happens? Go out and, do yoga, what happens? Have a great lovemaking session with your woman, what happens? Or man. And just hack in. A lot of people are just telling me, I don't know, I'll try this thing, I don't know if it's helping me or not.
Yeah.
And I think HRV is a great way to look at it.
Just by way of example, Brad, I went to a sound bath, and it was with my dad and my stepmom. It was a private session for 3 of us.
Nice.
And we did like a 45-minute sound bath. And then I went home, and I had the highest HRV that I've had in like 2 years.
Wow.
I woke up in the morning. First of all, you know how it is when you really have one of those nights of recovery. You just wake up with jet fuel in your veins.
And especially you, Dave. Give you enough fuel and you're good to go.
But then I'm saying to myself, how do I recreate that more often?
Yeah.
Because I felt so good that day.
Yeah. How do you tap
in? So then I looked back and I said, what did I do last night? And can I write that down, to your point, that experiment, and can I start to recreate the conditions that optimize HRV?
Yeah.
It's such a powerful indicator of like how I'm going to feel and perform.
So I did, I went to Kirtan singing,
Yeah.
A good guy named Krishna Das.
Yeah.
And my HRV tripled. And I didn't know until I was going back, looking through my old data, and I'm like, whoa, what happened on that night? I looked up on my calendar, I'm like, oh, wow.
So both of you and I had something that was more of a psycho-spiritual thing that we experimented with. Going back to your point, do an experiment and measure your HRV. I saw it in my data, clear as day.
Look at the data. That's what I tell people. Like, if it sounds a little wackadoodle, great. Look at the data. See if it in your own physiology and see what happens. So that's one hack, HRV.
Number 2.
2, I'm really excited about contrast bathing, experimenting with it. I think.
What is contrast bathing?
Yeah. So cold plunges. In contrast to hot sauna, go in, like, what is your HRV? What's your resilience before you decide to do your contrast bathing that day? And pay attention and moderate it based on how you're feeling. So that's another one, I think. And there's a huge amount of, your release shock protein. There's a lot of immune response you get to it. The hormetic event that you get from the acute stress event, this hormesis, leads to positive outcomes. So you just want to then, not overdo it.
So contrast therapy, right on.
All right, hack number 3.
Yeah.
I'm all about mining the mitochondria these days. Like, how can we, A, figure out better testing, and B, what kind of hacks can we do to, create better, higher functioning mitochondria, get rid of the ones that aren't working so well. What are good ways to tweak our mitochondria? One is fasting, right? Yep. So I'm a big fan of getting myself and others to do that. So either timed eating is one way, what we call intermittent fasting. I prefer to say timed eating. The other is just 24-hour or 72-hour fast. I also think exercise is a great one.
Completely agree.
I think zone 2 is great at sort of the...
Completely agree. And I've started to see some data on zone 2 and HRV.
Yeah.
That just being in zone 2 cardio actually is a strong boost towards heart rate variability.
Yeah, it's interesting because you're not overtaxing the system, number 1. Number 2, you're using fat as your fuel source, ideally, right? So, and again, that's sort of getting into this ketosis concept. And then also supplements. What are some interesting supplements that are out, though? There's urolithin A, and there's a few other ones that are out there, and people are trying to play with NAD plus and NMN. And I think you could start to play with some of these interventions by looking at, again, back to looking at your data.
Awesome. So, just to recap here, we've got understand and optimize your HRV.
Yeah.
Second one, contrast therapy.
Yep.
And third is juice your mitochondria.
Juice your
fasting, exercise, supplementation, light, cold, all the things to juice it.
Yep, exactly.
Awesome list, Dr. Brad.
Yeah, it was fun to hang out together.
Thanks, man.
Yeah, good being with you.